The governor says social distancing is working. In the meantime, the state is working to address additional needs of families and workers. Deputy Secretary of DHHS Ben Money joins us to talk about state assistance in healthcare, food, childcare, and more. Next on Focus on Coronavirus. Welcome to Focus on Coronavirus. I'm Deb Holt-Noel, and today I am pleased to welcome the Deputy Secretary of the North Carolina Department of Health and Human Services, Ben Money. Ben, thank you so much for being with us.
Thank you, Deborah. It's my pleasure.
Well, as we mentioned, the governor has said that we are doing well in terms of the social distancing, and at the same time, people are getting anxious. Protests are mounting so that North Carolina can get back to work. What kind of indicators are we looking for to try to relax some of these stay-at-home measures?
So there are several things that we're looking at. One, obviously, is just the rate of infection. And one of the challenges in determining the true rate of infection is just our ability to have more testing in the communities. And one of our rate limiting steps for testing is the ability of those providing the test to actually have personal protective equipment. As you know, there's a national shortage of personal protective equipment. In North Carolina, the North Carolina Department of Emergency Management, as well as DHHS, has been aggressively pursuing and purchasing personal protective equipment, but we still don't have enough to meet the needs for all the testing that we need to take place. So we need to see the number of cases start to decline, obviously the number of deaths start to decline. We need to have a better sense of where the virus is, how it is spreading, and be able to determine that the decline is such that we can begin the reopening of North Carolina. And we actually have a team of academic partners, as well as DHHS, business partners, and other stakeholders that are actually looking at what that process of reopening will be. I know that we're seeing in other states efforts to reopen as well. Folks are anxious, but I think it's important for us to recognize the fact that where we've seen in other parts of the world an early reopening, we've also seen spikes in the virus reemerging. It's a very aggressive virus. COVID-19 is a disease that we've not seen before. But we can take the lessons learned from other countries, other states, but also pandemics in the past. I was reading about Philadelphia back in the 1918 Spanish flu. They actually had a parade and reopened too early. And hundreds of people, as a result of that gathering, ended up getting the Spanish flu and dying. And that's something we certainly don't want to have happen. Too many people have sacrificed. They've shut their businesses down. They've foregone school and other opportunities. Healthcare providers have risked their lives providing care for folks. And we don't want to squander the sacrifices that have been made thus far by opening prematurely.
So it's as though we don't want to go too far at this point. And you mentioned something about testing. Where can North Carolinians get testing, and how is that working?
So North Carolinians should reach out to their healthcare providers for testing. Most of our healthcare providers have access to testing. Now, we are really prioritizing populations for testing. Obviously, folks that are in congregate settings where the risk of transmission of the virus is high, individuals that have compromised health conditions, folks that are symptomatic, we want to make sure that they get testing. And a lot of those limits are really based on the fact that we don't have enough personal protective equipment for those providing the tests. And we also are ramping up our supplies of available testing.
If someone is concerned that they might have COVID-19 and they want to go get that testing, is it pretty much in how many counties are testing sites available in right now? How much of a coverage do we have for that kind of thing?
So for county health departments, County health departments have access to testing. A lot of providers within counties have access to testing. Obviously, our large healthcare organizations, our academic medical centers, our health centers have testing, but they may have limitations on the testing. And again, we'd be prioritizing those populations that would be at higher risk. Again, until we have more testing capability, more personal protective equipment, there still are some limitations on the priority populations for folks that are getting tested. That's not an ideal scenario, and we're rapidly and aggressively moving to make testing more widespread and make it accessible for broader populations.
And I understand you're also working with a number of universities on not only testing, but tracing. Can you tell us what tracing looks like and about that relationship with the universities?
So tracing is pretty much core public health epidemiology 101. You know, it's what we do with other infectious diseases. It's identifying the individual who they've come in contact with, and then reaching out to those folks and testing them and determining whether or not, you know, they have the virus. And then, you know, following those same leads, who have they been in contact with, who they live with, who they work with, and continuing the testing and tracing those contacts until we actually can determine really the scope and the spread of the virus within communities. It's really shoe leather work. And we're trying to utilize technologies that are starting to emerge around the world and around the country to help facilitate that. And I think that's where a lot of our academic partners come in. We're very fortunate that the University of North Carolina at Chapel Hill has one of the top schools of public health in the country and a very strong epidemiology program. So, you know, we're leaning on them a lot. Several of our staff within DHHS also have dual academic credentials with UNC, and so we're very fortunate that we had that partnership also with Duke, with Wake Forest University, and I'm sure I'm leaving out others, NC State and the rest, but we are fortunate in the state that we do have a strong academic framework. And remember, Research Triangle Park was really based on having the connections between academia and research institutions and corporations, and so having that that connection again gives us an opportunity to leverage science, to leverage business acumen, and to leverage the work within the department to develop a contact testing and tracing capability that not only leverages boots on the ground, but actually technologies to assure that we can do this process in an effective and efficient way. And it's going to be a long-term process. I mean, the likelihood is when, you know, we do start to reopen, there will be hotspots that come up that we will need to address. There may be times when things open up and we may need to shut down again for a temporary basis. This is what we're seeing in other parts of the world. And so really getting ready for a longer term effort at reopening North Carolina, but assuring that through this process that people that have made the sacrifice are getting the resources that they need to sustain themselves.
Well, this kind of information is really preparation for what's to come, hopefully. And this virus has just been hard on everyone, from the people who are working the front lines to patients, and statistics are showing that some of the hardest hit populations are minority communities, in particular African American communities, where across the nation the percentage of COVID cases is at 30%, whereas African Americans only comprise about 13% of this nation. So is there data being collected about how COVID is spreading throughout North Carolina, and is any of that data demographically specific? What do we know about that here in our state?
Yes, we are collecting that data, and we're making that data available on our website, www.dhhs.gov, ncdhhs.gov. What we've found is that for North Carolina, the population of African Americans is 22%. The population of individuals that have COVID-19 that have been laboratory confirmed tested positive is 39%. And then the percentage of individuals that actually have passed away as a result of COVID is 38%. So disproportionately higher. Number of African Americans have been tested and diagnosed with COVID and then have expired. I think there's several factors that relate to that. One is the fact that when you will work a job that requires you to have frequent contact with the public. For example, if you're a cashier in a grocery store, or if you are someone that works in a healthcare setting where you have direct contact with patients on a regular basis, you are presenting yourself with more opportunities for exposure. So every time that cashier at the grocery store shows up for their job, they're seeing new people, different people on a frequent basis. And so that increases the likelihood that COVID, that virus, will come in contact with them. That's one thing. Second thing is, in terms of the severity of the virus and negative outcomes, what we've seen around the world is that folks that have chronic conditions such as diabetes or hypertension, congestive heart failure, asthma, or if they're overweight, as well as other conditions, are at greater likelihood for a COVID infection to actually take a severe turn and perhaps lead to death. And so when we look at health disparities within North Carolina and within the nation, one of the things we find is that those conditions disproportionately affect African Americans. Likewise, African Americans, people of color, and folks that are low income don't have access to the same level of health care. And they also don't have access to employment that gives them the opportunity to telecommute, or employment that gives them the opportunity to take a paid sick day, or employment that actually provides health insurance. So there's some structural disincentives in place that prevent them from taking the necessary care that they need for themselves. We also find that folks that are working in the service industry often have precarious child care arrangements. And in many instances, those child care arrangements are really dependent upon caregivers. And sometimes those caregivers are members of their family. It may be their grandparents or great aunts or other older people. And again, being over 60 is really a risk factor for COVID. So children, particularly if children have contact with others, or if that employee then goes and picks up their child at the end of a shift and exposes that elderly caregiver to COVID, then they run the risk themselves of contracting the virus, even if they're simply staying at home. So there are several confounding factors that can lead to African Americans, people of color, low-income folks being disparately affected by COVID-19.
And now people are talking about the impact also of implicit bias at the doctor's office when African Americans or people of color go to get treatment. So knowing all of this, what is the state doing to try to mitigate some of that?
So one of the things that you've seen from the governor is executive orders that have really mandated social distancing. And most recently, for grocery stores, actually creating the social distancing flows through the store so that people don't come in contact with others as they're shopping, limiting the number of people that actually can be in those retail establishments. And then also having shields, plastic plexiglass guards between the cashier and the patrons in the store, mandating hand washing, hand sanitizing, cleaning surfaces, the things that we need to do to assure that workers are protected, but also that we, as residents of the state, have access to food and access to the essential things that we need to be able to stay home, to be able to shelter in place, to be able to have that social distancing and maintain a level of functioning within North Carolina.
Ben, tell us a little bit about some of the programs, or at least one of them, where the state has stepped in to try to assist with obtaining food and also with child care. There's the 211 service, the texting tool. Talk a little bit about what those are, how they work.
Yeah. So we've really tried to make it convenient for folks to be able to access services for obtaining food, because we know that, for example, children that are home right now that normally would be in school and maybe on free and reduced lunch would be missing out on the opportunity to have breakfast or lunch. And so working with Department of Public Instruction, working with feeding centers to assure that there are meals in communities. We've also been working with the North Carolina Food Bank, working with other child care providers to assure that meals are going out, working with our Council on Aging to assure that Meals on Wheels services continue for the elderly. We want to make sure that people get fed. We also have spent a great bit of time working with our federal partners in creating waiver opportunities for certain programs so that we can maximize benefits for folks that are on food nutrition services, that we can create opportunities through our Medicaid program for Medicaid beneficiaries to have the services that they need. We've also created new ways that healthcare providers can connect with their patients through telemedicine and telephonic services, and created the opportunities for those providers to actually be able to receive payments for those services. So really taking advantage of technology, taking advantage of the opportunities that we have in interacting with the media, such as yourself, to get the message out, utilizing our website, working with partners in the telecommunications industry to free up more bandwidth for folks. And we know that there's a digital divide that exists.
There's a huge digital divide. So there's a lot of talk about virtual learning and virtual education. So
Yes.
Is that falling under your umbrella as well?
So it's falling with Department of Public Instruction, but as a state, we've been working in a very close manner between the various state agencies so that we are working to coordinate our messaging and the services that exist. One of the things that we know with the digital divide is that the lack of availability of broadband, particularly in rural areas, is an issue. So we've been really partnering with Appalachian Regional Commission out west on some initiatives, and with our Department of Information Technology at the state on strategies. And broadband in healthcare, broadband in education are really two areas, as well as business and industry. I think that with what we've learned from this COVID outbreak and the infrastructure that has been put in place in really short order, my hope is that a lot of these resources will remain, a lot of the efficiencies we put in place will remain, that there will be some good that will come out of what we've experienced in this COVID-19 pandemic.
And especially, and I don't want us to get away from those who might be watching who do need that food assistance, or who know someone who needs that food assistance. Tell us how exactly, if you can briefly, how the 211 service works, and then I believe there's a texting tool as well.
Yes, that's right. 211 is probably the best way of getting in, because those operators can actually refer you to the right place. And it's the easiest number to remember is the 211. I also just urge folks to utilize our website. We're constantly replenishing and refreshing, updating the information that's on our website. It really is a one-stop shop, and we've linked it with other state government websites. And particularly on the healthcare side and the guidance, we tie it directly into the Centers for Disease Control.
And it's got to be difficult for people, particularly in these rural areas or areas where broadband is not readily available. As much information as there is on the DHHS website, they're unable to get to it. So, how else are you working to make sure that communities get this information and get the assistance that they need?
Yeah, so we're very thankful for the media. We've really utilized the media with daily press briefings during the week. We also are leveraging printed materials as well, and working with our county departments of health, our county departments of social services to get the message out. We're very fortunate that so many entities have really rallied behind our efforts to support North Carolina during the COVID pandemic. That we are even putting signs up on the highway, on the interstate, for individuals to get information about COVID-19. So looking at just a myriad of strategies at both the local level and the county and state level to get the information out.
This is a lot of assistance coming down, and I imagine there's more to come. Can you talk about the difference between the federal assistance that's available and what's being provided by the state?
Yeah, so the federal assistance for us in the Department of Health and Human Services, a lot of it comes through the Centers for Disease Control. It comes from the Health and Human Services Department. We are working with our partners in agriculture and USDA, particularly around the food and nutrition services programs. We have been in close coordination with the Centers for Medicaid and Medicare Services around waivers to get more benefits to people. Also, there's some national strategies that the Centers for Disease Control is sharing with states. And there's, I think, a good, healthy conversation about the approach that states are taking around testing and around contact tracing.
Because there is a difference between, there is a debate right now about whether this is going to come down from the, federal level, the testing, or are states going to be managing it? And how does that lay out? How does that layout been in terms of budget? Where does that funding come from?
Right now, the state is really taking the lead in terms of testing. There is guidance that's coming from the federal government. We are through our Medicaid waivers, creating more opportunities for federal support to come in. Also, we have federal support that will be coming in arrears from FEMA. And we also are drawing upon state dollars to assure that we can have the services that we need for this outbreak. Obviously, this was not something that was budgeted for. We didn't have COVID-19 in our sights when our state budget was done. Neither did the counties or even businesses. And so right now it's a matter of pulling from operating reserves that businesses have, from our state rainy day fund, but obviously, when you have an emergency, it's something that needs to be done. So we're utilizing the resources. We're very fortunate that our Office of State Budget and Management, as well as our state legislature, is cooperative in this effort, because we recognize that we can't spare costs to do the things that we need to do. I think the limitations have really been around resources and supplies, and that's the challenge that we're working very diligently to overcome.
And as people are protesting and wanting to get back to work, and everyone's kind of wanting to do this, what final message would you have to them to help them be encouraged about the progress that's happening?
My final message would be to be patient, to recognize that this is a situation that we're in that is going to take some time to resolve, that we will get back to a place where businesses can continue, stores can open up, that children can go to school, people can get back to work. But to do that in an effective way, to do that with a minimal loss of life, is going to require that we use our best knowledge, our best minds, our best strategies, data, and a scientific approach to how that happens. If we don't, if we open up prematurely, then again, the sacrifice that people have made to close their businesses or close school, work from home, forego employment even, will be in vain. If we open up too quickly and we have a major spike in COVID-19, we'll have additional loss of life, and the work and the sacrifice that occurred prior will not have the desired effect that we want it to have. So really urge people to be patient, to recognize the fact that we are going to be in a period of time where we're going to have softer openings. We're going to have openings that won't be like in one fell swoop, because that is the way that we can control and mitigate the spread of the virus and ensure that we can preserve life to the greatest extent possible.
Absolutely. Ben, thank you so much. It is going to take that patience, and we appreciate your time with us today. Thank you once again to Ben Money for joining us. For information about today's program, visit us online at unctv.org/coronavirus. For Focus On, I'm Deb Holt-Noel. Stay safe out there and have a good night.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC TV.